A woman's life is a series of hormonal transition from the girl's first period to menopause. The woman's body is evolving continuously. So, how about understanding her uh, through medical and psychological point of view than always adjusting and adhering to silent, treatment towards our own self? So, hi, I'm Arpita Mirchandani, senior psychologist at Bridge Health.
Hi, I'm Dr. Rekha, gynecologist and fertility specialist at Bridge Health. Rightly said, Arpita. So I know how we women are. When it comes to our own family members, be it our siblings or husband or children, we are so worried even at the slightest of the symptoms. The moment they voice out any symptom, we want a doctor health checkup, we want to take all precautions and be safe. And also we women are very meticulous when it comes to our work deadlines or maybe paying rents or maybe bills. But the same thing when it comes to voicing out our own worries or symptoms or anything, we take a back seat. There's some hesitation. I don't know why. We feel maybe it is embarrassing to share or something awkward silences around. It's all a hush hush. So maybe we have to start. It's time that we start voicing out together.
Yes, absolutely. Because women's health is something which even today when we have to speak about it, talk about the monthly cycle or anything like that, we hesitate. We feel embarrassed to even start the topic to another woman also.
Yes.
Yeah. So it's high time that we start talking about women's health openly and educating people around so we are more aware of each other and ourselves and we can support each other well.
Yes, very
So, yes. So, doctor, can we start with the first stage, which is called as puberty? Can you just help us understand the biological side of how a girl starts with her period and what are the changes?
Yeah, sure. See, puberty, as we know, it is a phase where the child matures into an adult. And that is what capable of reproduction. And usually, how this puberty is brought about is there are certain areas of the brain which send signals to the ovaries. I'm sure you have read in your biology, you remember the diagram of the female reproductive tract. We all have two ovaries. So once the signals the ovaries receives, they start secreting the female hormones, mainly estrogen, and this brings about the period. And usually the average age, I would say, for this first occurrence of periods is between 9 to 15 years.
Oh, okay. So it start. We can expect any time between 9 to 15
Yes,
years.
yes.
Okay. And how is it that a girl should be aware of her body for the preparation of of puberty?
Yeah, that's what it's a very important topic that you told me. See, usually what happens, the girl is very scared. She doesn't know what is happening with her. So suddenly, see, there'll be, even before the actual first period, there are a lot of other changes, physical changes that the girl experiences, right from growth spurt to development of breast, development of the axillary and pubic hair. So what happens, she suddenly sees there are some changes in her body. So is it something that she has to share? Who is the right person? Or something abnormal happening with her.
Correct.
So I always tell all my patients whenever they come, the mothers especially, that you have to have that first conversation with your daughter even before the first period starts. At least to certain extent, she should have. That means by the time she gets her period, she shouldn't be scared or anxious.
Right. Yes. Though there is a lot of awareness around this, but still girls go through, a lot of confusion, overwhelming emotional, turmoil which they go through. Plus, along with that, the woman who has already experienced this, that is the elder woman in the family, still she is unaware what is happening to the child. So a lot of emotional up and down also happens in this.
Yes.
And doctor, what I have noticed when I am interacting with my client of this age who has a mother who's going through her own phase
Yes.
and the girl child who's just about to have a periods or something. It happens like they're very scared of that irregular period. What
Yes.
happens? How aware should they be about this irregular periods?
Yeah, see, I would say some amount of irregularity in the initial years is, I don't say it's normal, I would say it's quite common.
Mhm.
So, what happens is the hormones, what I mentioned earlier, they take certain time to have a set pattern.
Okay.
So, maybe for the initial 2 3 years,
Mm.
after the first period, some amount of irregularity once in a while is fine. So, but again, how inconsistent or how consistent it is important.
Mm.
For example, if the girl is, for example, I had a recent one of my client, the mother had got a child. The child had just didn't have a period almost for 2 months, and then the mother was so panicked and all that. Then I told her, just be calm. What is the age of your child? She said it's only 11 years, and the child had got a period just 6 months back. I said, see, getting awareness, yes, definitely right, but there's nothing to panic because the hormones take some time.
Yes.
And I would say the red flags that the parents should watch out during this time are, one is if the periods are very irregular, maybe like once in 3 months, 6 months, 8 months, something like that. Or next is the heavy periods. So
Okay.
if the bleeding is very heavy, that is once in 2 3 hours she has to change a pad, or if it lasts more than 7 days. So that is one of the red flags. Then third one would be pain. See, we all know that some amount of pain we all experience, maybe for the first 24 to 48 hours. But by chance it lasts more than that, and it is such severe that she cannot do her routine activities, and she misses her schools and colleges every month, or she has to take lot of tablets, maybe 5 to 6, or take a painkiller shot every month. Then I would say just a gynecological assessment so that we understand if there are any other underlying cause for such.
Yes.
So that is very mandatory.
Yes. And to add on to this, the moods usually they complain about the teenage girls, especially going through that mood swings, and they say that she has attitude, she's very rude, and all. I think it's a hormone influence
Yes,
which is
definitely.
happening.
See, the child is undergoing, as you mentioned, lot of confusion.
Yeah.
It is not aware
Yeah.
what is happening with it. So that awareness is very important from the parent side, because there's a lot of information going around, right from social media to friends everywhere. So the right amount of information should reach the child.
Absolutely. So when you are aware of your body biologically, at the same time when you're aware of it emotionally, emotions are a good indicator what we are going through. It really helps us understand ourselves and our body, and we can always sail through this phase mindfully. I would put it across like that. So when I interact with clients saying that, oh, my daughter is so rude with me, I'm not able to gel with her at this phase, I would like to, as you mentioned, we have to be prepared for this change, and the girl also should be given confidence from the parent that it's absolutely okay and it is a phase you're preparing for your next stage of life.
Very true.
Yeah. And talking about next stage, I think so that is well spoken about everywhere in different ways. The reproductive phase, yeah, and where the woman is building her career, picking up on responsibility. She wants to look slim. She wants to work out. She has to keep up to so many other things. With that comes a big problem, doctor. And you would be the good person to.
Yeah, I think
talk to
I'm
about.
understanding where you're heading to.
Yeah.
PMS,
Yes.
premenstrual syndrome.
Yeah.
I think a lot of hype around that because
Yes.
I myself go through this.
Yes.
So premenstrual syndrome is a collective symptoms that the woman experiences religiously every month, just few days prior to the actual period. But usually it improves on the onset of periods. So what are these changes? Again, it is hormonal. So we have this withdrawal of hormones, mainly progesterone, which brings about the period, and with that there is some amount of salt water retention in the body, bringing about the symptoms, right from irritation, mood swings, and also breast heaviness, and also constipation. And by chance we weigh ourselves on the scale, suddenly the scale goes up. So we are following everything healthy, doing everything right, and what is this? Because this is a temporary water retention in the body. So after the fifth or sixth day, definitely the weight comes down. And I describe it as the period of highs and lows. So because what happens, for example, I might just cry out just looking at a lone puppy, and next 5 minutes I might be arguing with you like an expert lawyer, as if they've done a crime for the silliest of the reasons, and then go into a guilt trip. So that is the kind. And I just remember to tell you one of the article I read few years back in US. They've done a study where they found that the crime rate in women is highest when they are in this PMS phase.
Yes, yes. Even I came across that article, and just imagine what kind of impact these hormones are doing on us. And
Yes.
emotionally, we don't know what's happening.
Yes.
With to balance this out, I think so. Mindful living is good.
Yes, definitely. See, there are certain triggering factors for this
Yeah.
PMS.
Yeah.
The poor lifestyle choices, poor sleep patterns, sedentary lifestyle,
Okay.
and having foods that are high in caffeine, alcohol, sugar, spicy foods.
Oh.
So all this definitely increases. So I always tell all my clients, see, leading a healthy life, yes, but at least if not the whole cycle, I say keep all your cravings for the first half of the cycle. Your momos, pizzas, everything for the first half. The second half, that is at least 10 days before the actual period, follow a very sattvic lifestyle. Matlab, having foods that are less in sugars and spicy, all that. So some studies have shown. So when you maintain a very healthy lifestyle, both your PMS and even the period pain, dysmenorrhea, what we call, gradually over time they start decreasing.
So, but coming to cravings, when you mentioned cravings, we all experience cravings at its peak during that.
It is highest during that
Yes.
phase.
And we feel like eating chocolate.
That itself is like an indication that the period is about to start.
Yeah, and I think so. Even the irritation, what you go through during that
Extreme
phase.
anger and agitation.
Yes, yeah. As you mentioned about the article,
Yes.
it leads to a lot of roller coaster of emotions up and down. We don't know what we are going through, what emotions to really rely on, and people around us also are scared to be around.
No, we are termed dramatic.
Yes.
So that's the word that they use. Oh, you're being full of drama. You're being a drama queen.
Yes.
But what we go through, we only understand that.
Yes. Yeah. Yeah, and along with this, because of the role of the woman, it causes a lot of stress.
Yes, definitely.
Yeah, and how does it impact on the fertility of?
See, fertility is one more different topic. So, and I am being a fertility specialist. There are I see a diverse amount of clients, but the commonest what I encounter, the cause I would say, especially in females, is PCOD. Again, one more overhyped topic. I'm sure. Right from YouTubers, Instagrammers, everywhere you see there's so much of information.
Yes.
I'm okay with the information, but there shouldn't be any misinformation about the same. Because what happens, the woman is scared to death. I have had so many clients, they come like, doctor, please help me, I've had PCOD. I'm like, so what? Relax. There's nothing to worry so much. Already your ovaries are chaotic. I don't want your mind to get so much messed up. So I say, calm, sit down, let's work together. So PCOD is polycystic ovarian disease. So, but the name is a misnomer. There are no cysts per se. Actually, it is increase in the average number of follicles that the ovaries usually have. Maybe usually 6 to 7 or 7 to 8 is the average number of follicles a woman has in each ovary. But here it may be 20, 30, I've even seen 40. But the catch is these follicles are immature. So that way what happens from a fertility point of view, the quality is a little on the lesser side. So that is the main thing.
So that is the reason it impacts on their mood.
Definitely. See, there again, it is an hormonal imbalance, as I told you. There is a little bit increase in the androgens, the male hormone, what we say, and the female's hormone, there may some amount of imbalance. The LH FSH ratio, what we say. So that acne, irregular cycles, weight gain, bloating again. So, and hirsutism, unwanted hair growth. So that is one vicious cycle. So and a lot of bodily issues because of this image consciousness.
Yes. I have many clients who who has PCOD, PCOS. When they talk about it, they talk about their condition, physical condition. At the same time, they go through a lot of body image concerns, confidence. It impacts their energy levels on the day-to-day life. The relationship also,
And you mentioned one more, PCOD and PCOS. So I just want to say here, see, these two terms are used very interchangeably, but they're not actually the same. So if you may ask me, PCOD is something that is to start with polycystic ovarian disease, where it is more of a hormonal and limited to the ovaries. But as the spectrum progresses, it becomes more of a metabolic disruption. So insulin resistance, development of type 2 diabetes. So it is more of a metabolic problem then. So that is polycystic ovarian syndrome.
That's such a
Yes,
informative message you gave right
yes.
now. But a lot of us are unaware of
Yes,
this.
and
Yeah,
luckily, see, the happy
yeah.
news is there's nothing to worry.
Mm.
PCOD or PCOS, whatever it is, definitely a holistic lifestyle management definitely improves the outcomes. See, at our own Breach Health, you know
Yeah.
that we have a program running.
Yes.
I'm there to guide, and you are there to help them to cope up with their stress.
Yes,
Our
yeah.
nutritionists, then our fitness experts, and we
Yes.
also have our expert physicians who
Absolutely.
can reset their metabolisms.
Yes.
So PCOD doesn't need to define us.
Yeah.
So the awareness definitely empowers us.
Yes, yeah, absolutely. Being aware, we will not be scared of what is happening within us, or when we notice something is happening to others. So awareness is the best solution,
Yes.
for all this. Yeah, and when we are talking of awareness, we'll have to pick up a topic, the phase of life where people are unaware mostly.
Yes.
That is menopause. Yeah,
Yes.
so it will be nice if you highlight
Definitely.
on
So
that.
that is
Yeah.
a very important phase of a woman. So I would say it's a phase where the woman can reinvent herself. So I say it's like an upgradation to a VIP status itself. It's not, I know, because and the first sentence that the woman who comes to me, walks into my OPD, she always says, Doctor, I don't recognize myself. I was never this person. I don't know what's happening with me. It's a new me. I don't like myself. So I tell her, calm down. It is a phase. But the thing is, see, menopause is a term that we use when the woman doesn't get her period almost for 12 or more months. But before that, the preparation phase, what we call as the perimenopause, which is the most important phase.
Yeah.
So, see, as the hormones, again, it is a hormonal phase. The main hormone, the hero hormone, what we say, or the heroine hormone. So, estrogen, which was there throughout the reproductive phase, it starts declining. So, that is how it brings about the menopause. So, as it starts declining, there are a lot of functions that it was taking care. So all these functions start suffering right from head to toe. If we say the irritability, mood swings,
Yes.
and it's like an exaggeration of the PMS symptoms. I can say that way. And hot flushes.
Yes.
So I just had a recent client of mine. She has a quite great sense of humor. She just came to me, Doctor, off late I don't need to use a weather app. I said, what happened? No, my hot flushes are more than enough. That every 20 minutes it gives me a weather update of my body. I laughed out, but then I thought how much that woman has suffered and endured.
Yes.
She told like her whatever loved ones, everybody seniors at the home, they told her no, this it's menopause, so you have to endure it.
Yeah.
So and recently she got little bit awareness. She thought maybe she should speak to a gynaec and just met me. So there are lots of women going through that.
Yes,
And
it's lack of awareness.
Yes.
We are not aware of our own body.
Yes.
What is happening. We are so much into doing our daily chores and keeping up to our life demands. We ignore the system which is taking care of us.
Yes.
In turn.
And
Yeah.
one more important
Yeah.
Symptom I would say, osteoporosis, so you have heard a lot.
Yeah.
That is loss of the bone mineral density. So the tendency to fractures is very high in this woman.
Yes, yes.
And the other one would be vaginal dryness, which is a less the topic that is not openly spoken. So the woman there's loss of lubrication, so vaginal dryness. So whatever the pleasurable activity of sexual intercourse, it becomes more painful for the woman. So, but what happens? The woman feels embarrassed. She's not aware of that. She feels something abnormal happening, and she doesn't voice it out even to her partner. But the partner, from his side, thinks that she's distancing herself. So, some merited disharmony is very common in this.
Yes, I've
group.
heard of it because many clients do talk to us about saying that they don't have interest in intimacy.
Yes.
There is there is a gap between the partner and them.
No, most of the times it is
Yeah.
not just because it's more to do, as you said, the mental this one.
Yeah.
That and that pain.
Yeah.
And they don't voice it out. They just say, I don't know, I've just lost interest. If you dig deeper, then they say, no, I have pain, doctor. That is the reason I can't go through that.
Go through that.
It's
Yes,
like a
yeah.
punishment for them.
Yes, and at the same time, because of lot of fluctuation in their energy levels, they don't know how to conduct themselves also at sometimes.
Yes.
sudden there is a irritation. Suddenly they are happy.
It's
They
just like
want
an
to break
exaggeration
free.
of the C.
Yeah.
PMS may you have all the symptoms few
Mm.
days prior, but
Mm.
here it is like throughout the cycle
Mm.
or throughout the day. It's like that. So,
So
but
better both the partners.
I always make sure, very
Yeah.
rightly you told,
Yeah.
I always make sure whenever a woman in the perimenopausal age group, that is
Mm.
after
Mm.
her 40s or 45s,
Mm.
reaches out to me for any smallest of the concerns, I
Mm.
always make sure that one of her partner or her children, grown-up children or any loved ones,
Mm.
let them accompany so that she also has to get the awareness, accept that this is a phase that she's going through, nothing to be scared of.
All
And
right.
meanwhile, the loved one has to understand that they have to support
Yes.
her in all ways.
Correct. Yeah. Yeah. It is a challenge, though. I would like to mention that
Yes.
yeah, I don't want to scare the other family members who are watching us, but at the same time, it is a challenge to balance it out. Again, being in your awareness, observing each other,
Yes.
good communication, practicing mindfulness, do a little bit of yoga, a little bit of strength training, all
Yes,
this.
strength training helps a lot,
Yeah.
especially to prevent or at least delay the osteoporosis, I would
Yes.
say.
Yeah, yeah. That's something sudden muscle loss which
Yes.
happens in this phase. Yes. And what about the irregularity of periods in this phase?
See, I told you because hormones are fluctuating in this phase, the estrogen. So some amount of irregularity in the perimenopausal age group that
Okay.
happens.
Okay.
So what happens? That is like a preparation phase for the actual menopause.
Mm.
So that is very, I could say, customized.
Mm.
So the woman may get it once in 3 months, 4 months, or something. So I'm not really worried too much about it.
Mm.
But a baseline health checkup at all times she has to have, so that we know, because she's also at a higher risk of other things also, with metabolic risk or heart health. So everything is very, very important. So regular checkups with the physician, with the gynecologist is a must. And also some amount of breast and cervical cancer screening.
Yes.
So that is very, very important.
Okay.
So in our country, breast is the cancer is the first commonest cancer in
Yes.
females, and cervical is the second most common.
Mm.
So all as with age, because whenever she's in the menopause, in this one, the age also increases. So definitely age-related risk also would be on a higher level.
Yeah.
So some form of preventive screening is fine. And irregular periods, we don't really give too much of importance, just provided the other, on the whole, our overall health status is fine.
Okay.
But once she doesn't, for example, 12 months she has not got her period, so we term her as menopause.
Okay.
But after that, if by chance a postmenopausal, what we call her, by chance she develops some amount of bleeding, then it is very significant.
Okay.
Even if it is spotting, I would say just one bit, definitely a gynecological assessment is necessary. Because what happens in this age group, there are a lot of what we say differential diagnosis. What could be, it may be silliest of the reason, like some abrasion or some local causes, what we say. Because recently I had a client, she said that, doctor, I stopped my periods almost 2 years ago, and suddenly I noticed some blood. Then I calmed her down. I asked her, when I examined, everything looked fine, the hormones, everything. But finally I asked her exactly how, when, where did you notice? She told, doctor, when I went use the washroom, little bit of bladder of skin.
Oh, okay.
So that was a severe urinary tract infection. So it was nothing to do with vaginal or anything. But on a serious note, also the risk of cancers increases during this time, be it endometrial or cervical. So that's why we should be a little more vigilant. We can't take things like too casual or something. Just an assessment. I'm not here to spread panic around, but just an assessment. I would say don't neglect it.
Yeah. At the same time, there are women who come to me and say that I can't lose weight at this time.
Okay, menopause, you mean?
Menopause.
Okay.
Yes. Yeah, I am not able to lose weight. I am growing facial hair.
Yes.
So
No,
that
see,
affects their confidence and
definitely.
all that. So could you highlight?
No, actually, see, there's a sentence that women say, doctor, I think menopause, that's why I'm gaining weight. I say it's an excuse you're giving, nothing of that sort.
Okay.
No, actually, what happens is, on a serious note, menopause itself will not allow them to gain weight. It is not that way. There is a, as I told you, estrogen throughout reproductive phase it is there, and the fat distribution because of estrogen is different. So it's mainly on the thighs and hips. But during menopause, what happens? The estrogen level is less, and therefore the distribution will be more of a male pattern. So it will be more in the abdomen. That is, the belly fat will be more. So that is one thing. Other than that, again, see, their age also increases during that time. So what happens? The woman, she's undergoing this hot flushes and all those kinds of things. She may not have slept properly. So in some form of stress, she doesn't know what is happening with her. So cortisol level increases. That
Okay.
also increases the weight. Somehow
Okay.
they seem to be little lethargic and
Yes.
so many things
Yes.
happening.
Yeah.
So all that increases.
Yeah. Mentally, they feel that they can do so many things, but the body is not
Yes.
supporting.
Yes.
Yeah. And what about the facial hair, doctor?
No,
That
that is
also
just because
differs.
androgens.
Okay.
So see, the male hormone, whatever testosterone, and a little bit on the higher side in
Okay.
women.
Okay. This reminds me of a reel which I watched on Instagram.
Yeah.
There is a stand-up comedian. She's also in her 40s.
Okay.
So tells that her friend came to her and she said that, suddenly I'm growing all facial hair. And she says, you've been your man so many years, no? Now the man in you is coming out.
Okay.
So there is so much of joke around this,
Yes.
but we really don't know what is really happening
Exactly,
within us.
exactly.
And it is so different from one woman to the other woman.
That's why it's a customized thing. See,
Yeah.
at Brijal, we have for that solution
Yes.
also. If they just visit us,
Yes.
so that see that awareness becomes easy, and we have a holistic team out here.
Right.
So that really helps. It's just that they have to seek the right kind of advice at the right time.
Yeah, always prevention is better than
Definitely.
cure, and awareness is even more better.
Definitely.
Yeah. Yes. So, doctor, before we wind up,
Yeah.
I would like to ask you what kind of screening a woman should uh, keep up on a yearly basis, and from what age she has to start doing this. If you could tell
See,
me.
one I have already mentioned to you the main cancers that are common in our country. One is the breast cancer. So breast cancer again we have screening methods, mammogram. I'm sure you have heard N number.
Yes.
So we have a little bit AI based newer technologies in that also called the Mammo Smart Pro. So here also I think at our center also we have that. So it's a no touch, no pain policy. The main thing is at least yearly once, at least after the age of 40. Unless there is no high risk at her home. High risk matlab maybe she has other comorbidities or some family members or distant relatives with the same cancer or any genetic predispositions, anything of that sort, then I would say little bit early. Maybe sometimes even 30 also we start. Otherwise, at least after 40, yearly once a mammogram or a mammosmog. But other than that, monthly basis, all women definitely have to do a self breast examination. That is, it's self-explanatory. Monthly basis, they have to just examine their breast, just look for any abnormality, anything, slightest of the thing, they can visit a gynaec and just know whether it is anything of a concern. So that would be one thing. The second one, pap smear. I'm sure you know much about it. So pap smear is again for the cervical cancer screening test. Usually we started almost at around 21 years. So I would say like just after the woman starts a sexual activity itself. So and again yearly once. So because usually if you go the statistics, they say like maybe once in 3 years, once in abroad if you go. But for our country where the geographic distribution based on that, I would say yearly once, if not at least 2 years once. And we also have the hero vaccine, the HPV vaccine. I think you know that's a preventive method. So that we start almost between almost from 9 to 10 years itself, and up to almost 26 years we give that, and that is again up to almost 45 years based on the Indian population. We prolong that, so almost between 9 to 45 years, and it is not only for. I know we are talking about women's health here, but the vaccine is not only for women; it's also for men because it also causes some amount of penile cancers, oral cancers. So that way it protects both men and women.
Yes, yeah. Thank you, doctor, so much on highlighting a very important part where we miss out on going on a regular screening for ourselves. Thank you so much on highlighting that. Yeah. Along with this, I would like to add on saying that ladies, just be very mindful. Observe your body. Let your emotions guide you. Take that pause in a month where you can reflect upon yourself to understand what is happening in you and be very open to communicate. We have doctors everywhere. We are also available over here. And please do reach out to us. Do not hesitate.
So I would say let's replace the embarrassment with empowerment, myths with facts, and the fear with courage. Let's bridge the unspoken words with voices.
Yeah, wonderful, doctor. Yeah, with this, we come to the end of our podcast. Yeah, hope it was beneficial for all of you. And please reach out whenever needed. Thank you very much.
Thank you.